This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. I'm Professor Michael Chapman. I'm a fertility specialist working at Life Fertility Sydney. I've been working in the area of infertility for more than 35 years. I was first involved in IVF in 1985, so I've seen the whole gamut of what is one of the great advances in science in the last century. So tonight we're going to talk about 2 or 3 issues. We'll start off with IVF's not for everybody, and I've said that many times. I'm afraid that patients, when they come to see a doctor because they're not trying to get pregnant, think that IVF is the way to go. But in fact, a vast majority of you will actually conceive without having to go through the traumas of IVF. So I thought tonight I'd talk about what those first steps are. So you've been trying to get pregnant. If you're under 35, and you've not been trying for more than 6 months, then the odds are you actually get pregnant on your own unless there's some issues. Nothing I will do will actually change things. So my first piece of advice is, if you're under 35 and you've been trying for 6 months and you're getting frustrated, yes, come and see us. I mean, I enjoy seeing patients at that point, because what I'll do is make sure that everything is normal, that you're ovulating, the sperm's good, and your tubes are open. But ultimately, over the next 6 months, you've got a better than an IVF chance of getting pregnant on your own without the expense and the trauma of going through an IVF cycle. Now, if you get to the 12-month point and you haven't conceived, then yes, come and see me and we'll work through all of those things, the sperm analysis, an ultrasound test to check that your tubes are patent, open, so the sperm and the egg can get together and that you're making an egg on a regular basis. And at that point, we will be probably saying, try for another month or 2 on your own before we move on to anything more invasive. The exceptions to that conversation are those where there are potential issues. So if you are trying and then you suddenly realize that your periods aren't 28 days, they're 35 to 40 or sometimes 21, and maybe there's an issue there. The issue is likely to be that you're not ovulating on a regular basis. Again, IVF's not the treatment for that. Treatment for that is actually doing proper investigations to find out why. And most likely that will be polycystic ovarian disease or syndrome, whatever. And for 90% of patients, taking tablets for 5 days a month will create ovulation, which will then end up with a pregnancy without having to go to IVF. So irregular periods, worthwhile coming and seeing a specialist early. Happy to see you. You're the group of patients who I have most success with without doing IVF. Obviously, the other issue in getting pregnant is not only making an egg, but also having a good sperm count. A sperm count that will enable sperm to get in the right place, the right time. So doing a sperm test is going to be important in the total investigation. Doing that early on is a good idea if things are not happening, just to reassure everybody that it's okay. The big advantage of a semen analysis in terms of determining where we go is that once you've got any sperm, and about 5% of men in fertile couples, about 5% will end up having no sperm, and that's an issue. And again, that's a whole different story. But for the other 95%, whatever sperm is there available, we can use in IVF to create an embryo. That's not going to be a problem. But knowing where you are is probably a good thing to be doing. You've been trying for 12 months. You've come to me. I will go through all of those tests, the sperm analysis, the tubal patency test. And the tubal patency test is interesting because in the 3 months, despite not getting pregnant in 12 months, if I do this ICOSI, it's called, if I do that test and flush through the tubes, there's a 25% chance of being pregnant in the next 2 to 3 months without me doing anything. Again, you don't need IVF. If you have irregular periods, I've said already, we give you tablets to start with, and then we move on to other approaches in that situation. If everything is normal and we get to that 12-month mark and we do all those tests and still things are not happening, what we do is move on to intrauterine insemination. If you're under the age of 38, over 38, maybe I am moving more to IVF as the next step. But under 38, intrauterine insemination is probably the way to go. What that means is, again, giving you medications, either tablets or injections, to make sure you ovulate well and the hormone environment for the egg and the sperm are good after ovulation. And then we take your partner's sperm, put it through a process where we separate a small volume of the very best sperm, and having created that, we put that actually inside your uterus. So it's not a matter of having intercourse. It's not a matter of the sperm having to find their way through the cervical canal. We've already done that for you. And those sperm, those good swimmers, will make their way up to find the egg on the right day. And what we've done is actually monitor your cycle so that we know that the right day is the right day for sperm to be in the right place and hopefully the right time. And that brings you a pregnancy rate, if you're under 38, of something in the order of 15 to 20% per cycle, which is far better than after 12 months of trying your own pregnancy rate. Your own pregnancy rate around after 12 months of trying is down to around 10% per cycle. So we're doubling your chances of getting pregnant using IUI. And if that fails, then we go on to IVF. But it's it's down that track. It's not the first step. I do have concerns that some of my colleagues take people too early to go to the IVF step with all its financial implications and the emotional stress, which is significantly higher than any of the other treatments. So that's the first stages of looking. Now, I've been talking about women 38 and less. If you're 38 and above, and you're having trouble getting pregnant, come and see us by 6 months. 6 months of trying, it's not because pregnancy rates are substantially less. It's because we want to make sure that there's nothing that's actually stopping you getting pregnant, because time is starting to run out. Egg quality is getting less, eggs of numbers are getting less. And if you do need to have IVF, you should be doing it sooner rather than later. So that's the exception. The exception is that you're over 38. Come sooner, be checked, and then decide whether we need to move on to more invasive, more costly therapies like IVF.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.